My name is Teresa. I grow a normal size, but I start gain weight maybe 5 years ago. Start getting problems with my back, my knees, and I guess I was thinking it was time for me to do something about it.
My name is Dr. Tanya Scurry. I'm the Medical Director of Body and Mind Medical Weight Loss Center in Ontario, California. I have known Teresa for over 10 years. She's actually the person who helped me on the road to losing weight. I've, at my heaviest, have been 500 pounds. Up until December 2012, when I had weight loss surgery, I wasn't able to move around. I was out of breath all the time. And she was kind enough to offer to prepare my food. So here I am actually more than 3 years later, and I've lost 300 pounds. And she was also instrumental in my deciding to start this weight loss center.
Come on up. Go ahead and step on the scale.
I used to play soccer, ride bicycles. I used to go into the mountains, and I don't do that anymore because my weight.
How tall are you?
5'6". The change in my weight impact my mood. I don't exercise like I used to. I don't walk like I used to. So it's what I decide to go for this diet.
Okay, I'm gonna take the circumference measurement of your abdomen. Place right on top of your belly button for me.
After these 10 days with this diet, it's gonna improve my health and I'm gonna be a different person.
So Mrs. Baldwin, it's really good to see you. So what I'm going to do is I'm just going to check each nostril just to make sure there's nothing obstructing the nostrils. Okay. You just tilt your head back for me. The KE diet is a 10-day diet protocol that was used in Europe, specifically in Italy. It was started by a medical doctor there who found a way to use a very small nasogastric tube inserted into the nose, into the stomach, and it provided constant feeding for an individual for 10 days. It provides the proteins, the fats, and the essential nutrients to a person for 10 days. And what it does is it essentially eliminates hunger. There's no drugs involved, and there's no surgery involved. So what we see at the end of 10 days is on average people are losing between 10 and 20 pounds. The KE diet is very safe, and it's performed under a physician's supervision. It's performed with the strictest care to someone's health. It's a very short procedure. It's painless. Local anesthetic is used to insert the nasogastric tube. It's been brought to the United States, and it's being done in several locations in the United States. And we perform the procedure here in Southern California. Now, if at any time you're feeling uncomfortable and you need me to stop, you just say, please stop, or hold up your hand, okay? And then I will stop and take the tube out a little bit, okay?
Okay.
All right. The Nutritional Smart Tube is about the size of a little piece of spaghetti, and it is inserted into a nostril with the help of a lidocaine, and lidocaine is a local anesthetic. So it anesthetizes that side of the nostril that we're using, and usually people don't experience any pain. One of the other things we do is that when we are inserting the tube, we have someone drink water, and that helps for the person to swallow the tube more easily. The feeding solution is administered through the nasogastric tube. The other end of the tube is connected to 2 bags. One bag contains the protein solution and the other bag contains an oil solution. So the person is receiving their essential nutrients with protein and fats. The feeding is 24 hours a day. And what that does is it helps to eliminate the hunger, or to make the hunger very minimal. We give every patient a backpack, and the bags are inserted into the backpack. It's very easy to move around with the 2 bags. The feeding tube is actually attached to the face with a mild adhesive. And the backpack you would wear on your back is as a normal backpack, and you would go about your day as you would normally do. You would not be able to go swimming, so you couldn't submerge yourself in water. You couldn't go in a jacuzzi if you're going to submerge yourself in water. You can take a shower. You would just disconnect from the pump 10 minutes each time every day and then reconnect.
Okay, so we're gonna go through a quick list of what you're taking home with you. Okay, you're gonna have a kangaroo pump, okay, a kangaroo pump charger, 1 KE proprietary blend of protein powder, 1 Miralax bottle, okay. We have 2 kangaroo pump feeding bags, okay, these right here. We can take a set home as well. 3 strips to stick on your face.
I feel this diet is gonna help others because it's not surgery, it's not drugs, and you're not gonna be hungry.
So I've pre-mixed your protein blend for you. It's gonna be 2 scoops in the afternoon and 1 in the morning.
What I like about Body and Mind Medical Center, because I have personal trainer and a dietitian that give me focus in my goal.
So you have this little gear right here. You're gonna put it in, okay? You bring the tube through and it's stretchy, so you could stretch it around and you place in there. We're just gonna turn it on.
So what is involved in the 10-day treatment period is that you would follow up with the physician, myself. You would come into the office for your follow-up visits. A focused physical would be performed. We would make sure that your tube is intact. I will ask you if you're having any issues such as diarrhea, if you're having any cramping, any dizziness. You'll just let me know if you're having any type of symptoms whatsoever so that we can address those right away. On the other days of the diet, someone from my staff or myself will call you each day to find out how you're doing. You also will receive a 24-hour, 7-day-a-week phone number that will give you complete access to me or my staff if you should have any problems whatsoever. On day 10 of the diet, you would come into the office, and that's the day that the tube is removed. Also on that day, you would meet with our registered dietitian and our personal trainer for individualized nutrition and exercise plans. The amount of motivation necessary for the KE diet, I think, is the same type of motivation that is necessary for anyone who wants to get on the road to being healthier. The difference with Body and Mind Medical Weight Loss Center is that we're here to support you. We provide the support that a lot of times people don't get in other weight loss interventions. So if you're feeling that you don't have the motivation, if you think that your family's not supportive of what you're trying to do to get healthy, that's why we're here, is to pick up the slack and to tell you that you can do it and to help you move along and get towards your goal.
When my family and friends they're gonna find about my lose weight, they're gonna get surprised, but it's gonna be a really good surprise. I hope this is gonna help me when going back to my life, back to my old life.
It's not an extreme diet, it's an intervention. What's extreme is where we are with the level of obesity in this country. About 30, 40 years ago, many people didn't really know much about bariatric surgery. Now, with bariatric surgery being a very common procedure, you have more people who are having that procedure done. And in my mind, we need to fight the disease of obesity with everything we have. And to me, the KE diet is a wonderful intervention for those who've tried just about everything else. And here we are. We need other weapons in our arsenal to help people get to where they want to be health-wise.